And welcome back. Right now, 9:16. Today, June 1st, kicks off Men's Health and Men's Health Month. Joining us today to explain why having a month dedicated to men's health, what it means, and why it's so important, Truro Hospital primary care physician Dr. Kirk Bonner joins us this morning. And Dr. Bonner, men's health is important, and a lot of us men can be stubborn and say, we're just not going to go to the doctor. Why is there a Men's Health Month, and what do we need to do to really keep our health going?
So thank you for having me. I'm very glad to have a health month for men. We
Sure.
have health care promotions for women, especially Breast Health Month. But men also deserve some attention, and men are more likely to put off their health care. So this is a good time to promote the idea that there's a lot of care to have by men that's not getting done.
So what are some of the things that men really need to think about? Colonoscopies, what kind of checkups do we need just to kind of get a baseline for the future? Because, if things go wrong in the future, if you have those appointments early in life, you have that baseline to kind of go off of.
So a lot of screening is specific for an age group, but there's also screening that's specific for men. Colon cancer is prevalent in men, a lot of times at an earlier age than women, and we promote the colon screening. Also, heart disease prevention. A lot of habits people have that lead to heart disease that can go undetected late in men, much later than women actually, and we try to do our best to have a baseline to gauge somebody's possibility of having serious problems that they don't know about. Absolutely.
So even on top of this, maybe not so much going to the doctor, but things that you can really help yourself with and not indulge in alcohol. Drinking and driving is an issue. All these different things that sometimes us men we tend to do. You have to kind of think twice about these things.
Yeah, so men in particular are at increased risk of having habits become a healthcare problem. There's smoking, even nicotine alone is very harmful for the vascular system. And then there is alcohol, especially with this past year, people spend a lot of time at home. Drinking is up and binge drinking too, but even more than 2 alcoholic beverages a day on average leads to increased cancer risk as well as behavior healthcare problems.
So we talked about colonoscopy and getting your colon checked, and of course that's a leading issue with men and in fatalities annually. What about heart? What do we need to do for our heart? EKG? I mean, how deep do we need to go just to kind of get an idea of where we are?
So the most important thing is to have exercise and know that you tolerate exercise. And when we do stress testing to see whether you do have coronary artery disease, that requires activity. And with lack of activity, your increased chance goes up. High blood pressure, diabetes plays a role in that too. But definitely screening with EKG and your risk factors is important for men.
Absolutely. So what are some other things that we need to do? Because again, I've got a lot of friends who say, I haven't been to the doctor in 20 years. It's like, well, you've been feeling okay, but sometimes if you go, you can maybe get that screening that if you have an issue, catch it early. That's the best opportunity to cure it.
Yeah, so even if you feel well, even if your family's well, even if your family history is excellent, there's still be underlying problems that are potentially going to affect how long you live or your quality of life. So just basic screening can save lives and lead to higher quality of life too.
Absolutely, I agree. Well, every year I'm not a needle fan, but I get blood drawn and get all my panels done and all that stuff, and it's something that really people should do because with the pandemic it kind of makes you rethink your health and how vulnerable you may be to any type of disease.
Yeah, so I do have some advice for men especially. I would like that they schedule healthy meals at home. Less fast food is always important. Have a good diet. Schedule
Sure.
exercise during the week. Schedule sleep so you have a good rest. That's important for health. And schedule a primary care visit.
Absolutely. All good advice there. So June is National Men's Health Month. And, if you haven't seen the doc in a while, just go get checked out. It's easy. And you feel better, too. If everything looks good, it takes a weight off your shoulders.
Absolutely.
All right, Doc. Thank you very much for joining us this morning.
Well, thank you for having me.
All right. Have a great day.